I'm Julie Barkey with Senate Update. The state of Minnesota is experiencing one of the worst influenza and norovirus seasons in decades. This was the message delivered to the Senate Health, Housing, and Human Services Committee by the Department of Health. This season, 4 children in the state have died from influenza, and 315 schools have reported outbreaks. We caught up with Commissioner of Health Ed Ehlinger following the hearing to discuss the issue further. The quote is, relative to the influenza epidemic, it's crazy, early, widespread. Why is this?
Well, we have a strain of influenza that traditionally has been much more severe than other strains, the H3N2 strain. So that means we're having more severe disease, particularly among the elderly and young individuals. The fact that it's earlier is really one of those variations in influenza. It can come anytime between November and March. It just so happens that it happened in December, and so we had the large influx of disease, lots of outbreaks in schools and hospitals and long-term care in December. We're hoping that it'll settle down as the flu season progresses.
And we should differentiate. It's probably important to differentiate that that's not the same as norovirus, which many call the stomach flu, also relatively rampant this year. So is this kind of a double whammy to Minnesotans?
Well, influenza is more of a respiratory infection. Norovirus is a gastrointestinal infection. And this is really a foodborne issue where hand washing is really important and food preparation is really important. And it is our major cause of foodborne outbreaks in the state. And we've had a tremendous outbreak in the last couple of months in Minnesota, and it's really affecting a lot of individuals.
Commissioner, 315 schools have reported some sort of influenza outbreak. Do you think that this is overwhelming? Is it becoming overwhelming to Minnesota's healthcare system and to the school systems?
We know influenza affects schools. It does every year, some years more than others. This is one there, it's quite intensive. And when you get individuals together like you do in schools, there is the risk of transmission. That's why we really instruct people, if you're sick, stay home, get a flu shot. And we work with our school nurses and school superintendents to really have them work on how to limit the spread within the schools. It is one of those occupational hazards of being in a world where influenza is constantly changing and always present. So we just have to be ready to deal with whatever comes forward.
Finally, another quote from today's hearing. This is the new normal. So what do Minnesotans need to know, and what would you like to tell them to perhaps calm the waters a bit?
We cannot forget about infectious diseases. The bugs are very smart, and they're mutating and changing, and they'll find ways to persist. So we have to always be aware of the importance of immunizations. Vaccines are really important. Good hand washing, good personal hygiene, making sure that we continue to be eating and drinking appropriately, and if we get sick, to stay home from work or school so that you don't spread the disease to others.